Next on AM 1480 WLEA, the Newsmaker Show. Here's Ryan O'Neill.
Always glad to welcome Dr. Ismail Mehr to the microphones. We're going to be talking about the coronavirus and the New St. James today. Dr. Ismail Mehr, thank you for coming in.
Hey, thank you for having me. It's always a pleasure to be here. Exciting times for Hornell and everything going on with the new hospital and whatnot. And obviously some concerning times for us as a nation and as citizens of this world, with the coronavirus going on right now.
Dr. Ismail Mehr, let's start out with the coronavirus. There's a lot that you want to tell us about it. A lot of people have opinions. You're in the medical field, and you've traveled all over the world for, I think, a couple decades now doing Muslim missionary work with the Manna?
It's been been a little bit. So I think first and foremost is I'm definitely not an expert in infectious disease, but I've had the ability to be part of some meetings, some discussions because of the charity work I do and being a member of Imana, sort of a response for the American Muslim community, in terms of faith-based response on how communities are going to deal with the coronavirus. So I've been privileged to be part of some people who really know what they're talking about, so. If you want, I think first of all everyone just understand coronavirus in normal terminology because I know when we turn on CNN and Fox and whatnot, sources we watch, it's all scientific and people sort of want to understand what it is. So coronavirus is it's a type of virus. It's a family of viruses. There's multiple different viruses that fall under coronavirus. This current virus is actually called COVID-19, coronavirus disease 19. It's a cousin of SARS and MERS. It's believed, this virus originates from animals and then can transmit into humans at some form. The COVID-19 is a brand new virus. So that's why there's so much of a struggle in the scientific and medical world initially to understand it, to define it, to know what to do, and even now currently we don't know this virus. We have no studies on it. This is all new to us in terms of from a science perspective and a medical perspective. The first time it ever occurred in humans was December 19th, in December of 2019. The virus, a couple important things. So it's in your system for 2 to 14 days before you start giving symptoms. The average is 5 to 6 days. You've been infected and you start showing symptoms. What people don't understand is that you can start transmitting it to other people before you have symptoms. That's the important thing. You see all these things about gatherings and events and canceling of sporting events and this and that. The reason being is I agree with everyone. I was in the same boat a month ago that it's not that bad. Most people just have a mild hiccup, a little feel fatigued, they're not doing too well. And we're good to go. Not a big deal. That's what the whole world thought, and I thought as a physician as well. But like I said, it's a new virus. It's new. You have to understand it and see what happens. That's true for 80% of people. 80% of people, it's a bump in the road. Of those 80%, some of them will never even know they have it. The problem is that 20%. The 20%. So you're sitting at family dinner with your siblings and your parents. So there's 5 of you. It's like taking a gun that holds 5 bullets. You put 1 bullet in. You're gonna spin it and take a shot at someone. So 20% of people are at severe risk, and of those 20%, 20% of them, it's a 20% mortality rate, and that's what people don't understand. What we're trying to do is decrease the transmission of this virus so that we don't hurt the immunocompromised and the elderly. That's the sort of take-home message. Yes, wash your hands, do all that stuff, but when you start putting people together in communities, it spreads, and this is what's happened in China, and this is what's happened in Italy. The important thing to understand is something called the R naught in epidemiology. It's this number is the R number is what the ability of one person is to transmit to others. So if you have it, you will transmit this to about 2.4 to 3 people will definitely get this virus from you. You could be completely healthy, but you're going to give it to almost 3 people. Those 3 people are now going to transmit it to 3 people each. What's that? 9. Those 9, 3 people each is 27. You see where I'm getting at this? So it spreads like a wildfire. Again, many people want to compare it to the normal flu. The R naught or the R number for the influenza is like right around 1. So this is 3 times more transmission than the normal flu. And the mortality and morbidity in the elderly and immunocompromised is really, really high. That's what we're trying to explain to people is that 20 to 40% of people are going to have a severe disease reaction to it, and actually I stand corrected, about 20%. 15 to 20% of people who are infected are going to need hospitalization. So let me sort of bring the numbers into perspective, and I'm sorry I misspoke there. 20 to 40% of the world is going to be infected by coronavirus, COVID-19. That's been shown right now in all the sort of animations in terms of they know the numbers from China, from Southeast Asia, and Italy. So think about that. Just let's take that down to the United States. Between 20 and 40% of Americans will be infected by this virus. Of those, 15 to 20% of them are going to need to be hospitalized. That's a lot of people who may need to be hospitalized. If you take 330 million, multiply that times a conservative number of 15%. Of those people who are hospitalized, 10% are what the numbers are showing are going to need critical ICU care. So if we don't mitigate the spread of this virus, you're going to overrun the healthcare system potentially, and that's exactly what's happened in Italy. I was really, really surprised to learn that Italy has more hospital beds per capita than the United States. We have great healthcare, no doubt about it, but per capita, we have less beds per capita than Italy does. Italy no longer has any open beds for patients. That doesn't mean just COVID-19 patients. That means what about all the patients who have dialysis? What about all the patients who have diabetic complications? All the kids who end up getting the flu? All the people who have a heart attack? So once the healthcare system becomes overridden, we're going to have problems. And that's really where the goal is, to mitigate the spread of this disease. And I think that's where people need to understand is don't be selfish because you're in that 80%. Or we assume we're in that 80%. I assume I'm in that 80%. I'm very healthy. I'm 47 years old. If I get the coronavirus, probably going to be all right. But am I being selfish by wishing or hoping that we have the concerts and all the events and the parades because I'm positive I'm going to spread it to 3 people, and of those 3 people, there's someone who may not survive it. I think that's what the president, the governor, and public health officials are trying to share with people is that the transmission is like no other virus. It's really, really fast. Yes, the regular flu kills maybe more people. Yes, SARS and Ebola, all that. But it didn't spread as fast. If you don't contain it, you're going to spread it to everyone. And now you're rolling the dice because 1 out of 5 people will not survive it.
Talking to
in terms of the elderly, to clarify.
Sure. Talking with Hornell anesthesiologist, St. James anesthesiologist, Dr. Ismail Mehr. We're going to get to the topic of the new hospital. I did want to ask you, though, on the topic of shopping, going out and getting supplies, what's the best way to do that? And I mean, I heard someone on a press conference, a reporter from Olean on with Congressman Tom Reed the other day, and he was criticizing people who go overboard in the amount of toilet rolls they buy. Yeah. But what is the right way to shop? What is the right thing to do in this situation?
Unfortunately, we have hysteria on both sides. We have the doomsday sort of scenario for people, and it's like, there's no way, tomorrow's ending, the world is ending tomorrow. And then we have people who are completely in denial that this is anything of any seriousness. So I think we have to find a middle ground here. I don't think there's, the cat's out of the bag, the cat's out of the bag because now everyone is hoarding and buying so much stuff. I don't think we needed to do that. Just need to be realistic and be normal. Normal life does need to continue in certain ways, but for the foreseeable future, life as we know it has to change. But you know, that doesn't mean we're going to be completely confined to home or whatnot. I think we need to be smart on what we're doing here. You know, all the recommendations have been, you know, you washing your hands, cleaning your hands, sanitizers, you know, not touching close contact. You know, if you have elderly parents, you know, and you always go see them every single day and whatnot, you know, you may want to set up some family plans on sort of avoiding that contact for right now with them, you know, and avoiding, you know, doing things in your own family because you don't want to maybe spread the virus to them. And now they're amongst that 20% that are critically ill with a high mortality rate. You know, I think those are some of the sensible things. In terms of, I don't know what the right thing is in terms of the shopping and whatnot. To me, I think personally it's sort of foolish that we, you know, the toilet papers and everything is run off the shelves and whatnot. I think that was a mass hysteria that I tend to agree that maybe initially the media did create. And I think the medical side and the scientists were not sure what was going on, so we didn't have a lot of data to maybe speak up at that time and drive that away from it. But I'm really concerned about the other side of it too, that this is not anything that big. It's sort of a hoax, or it's a, you know, it's a political thing, or, you know, you can get on Facebook and see some crazy things there. This is truly a real problem. It's a pandemic. The World Health Organization doesn't call a pandemic lightly. The CDC, which is a government, you know, our, you know, sort of go-to medical, you know, and disease control center is, you know, bracing for something really potentially big here. Italy is a fine example of how things went wrong without sort of being prepared. And it's not at their fault because, like I said, it's a new virus. No one knew what was going to happen. So
I hear people saying, and I've seen people write, that the U.S. could end up like Italy in 2 weeks from now. What do you think of that scenario?
I hope it doesn't happen, but would I laugh at it and say, no, that's not going to happen? No, I can't say that. And again, you know, as everyone listening, this is not my field of expertise, but I've read a lot about it in the last few days and been on some conference calls with some pretty well qualified infectious disease physicians from here and around the world. Yeah, I think in science you can only you base off of what you've seen happening with the disease in front of you, you know. So Italy's a great learning tool for us, and that's what I think. The president is now, you know, come to realize as well after, you know, the scientists have come to understand that. And that's why you see these things going on. That's why there isn't a St. Paddy's Day parade tomorrow. That's why there isn't all this stuff going on in March Madness and whatnot. Because if you don't mitigate it, it's going to get there. You know, there's your percentage of death is based off of, you know, the number of people who are positive, right? If we can keep our number of cases positive, then we can have less mortality. And the only way to do that is less people getting infected. I think many of you have seen, everyone's heard the term now, flatten the curve. I'm not sure everyone understands that. You know, you'll turn on CNN and Sanjay Gupta saying that, you turn on Fox News, like, well, the curve's got to flatten. That curve is basically taking the number of cases of coronavirus over how fast it spreads from the day that person or people are infected. So if you decrease the transmission from person to person, the number of cases doesn't spike up. And now what's going to happen is it's going to take more days for it to keep spreading, correct? That allows for ultimately more time for healthcare systems to prepare, the ability to provide healthcare, and also if you decrease transmission, you have decreased number of cases at the end of the day. That's what flattening that curve means, and it sort of spreads it out over time versus putting it all acutely. Italy's is like a bell curve. It went straight up, and it's now they're over capacity. I mean, there's making decisions on who to give a ventilator to and who not to. So this is really happening in the world. It's not a, sci-fi type of movie thing. So for us to believe that it can't happen here would be very foolish. I hope it doesn't. And I think this is why governing bodies are canceling events, and we're trying to contain the transmission. Stop the transmission of it. We'll be able to contain it and mitigate.
Dr. Ismail Mehr is our guest today. You use the phrase flatten the curve. Another phrase that comes up, and it's a medical term, immunocompromised. What does that mean, and what does it have to do with the coronavirus?
So like I said, 80% of it's going to be mild disease. 20% going to get pretty bad. And when the ones that get pretty bad, 20% of them may not survive. Who's going to get really bad? It's been shown the elderly, 60 and plus, are more likely to get severe disease. Also in that 20%, it's shown that those are the word immunocompromised, immunodeficient, are going to get the brunt of the severity of this disease and not be as lucky as maybe others of their age range who are young and healthy. So immunocompromised is anyone, all your cancer patients, anyone who's on chemotherapy. Rheumatoid arthritis, and not to panic people, because I know that's a pretty common disease and people don't think about it, but people who have arthritis, they're on immunosuppressive medications. And I think most people out there who are on immunosuppressants know that. So yes, you are at risk of getting severe disease if you contract coronavirus. So if you're, the 42-year-old, mother at home who's got rheumatoid arthritis and yesterday was like, you know what, I'm young and healthy on the most part. This disease isn't really going to affect me. You be thankful that the governor and the president and our health officials are now saying no more large gatherings that you might have thought about attending because you contract it. You're immunocompromised because you're on immunosuppressive drugs for that arthritis. You could fall in that 20% that doesn't bear well. So it's really, really about transmission. And this virus transmits so easily. Look at the guy, the NBA player, and they've already tested a couple of his teammates now positive that I went back to. One person is going to, at minimum, transmit it to 2.4 to 3 people will get it. If I'm positive right now, how many people do you have in the studio right now? 4 or 5 people? 3 people are going to end up getting it as well. You understand what I'm saying?
Right.
Now, out of those people in your studio, I don't know who's immunocompromised. I don't know who's over 60, but those ones who possibly are, now they go to that 20% that might not make it. So this is about not being selfish, and we're all, I think, being really selfish, many of us at times, about, man, why they cancel March Madness, or why they're canceling schools, or why are they doing this, or why are they doing that. It's so that we help and look after our fellow Americans who may not be as healthy as us. I think that's ultimately the goal right now.
Talking to Dr. Ismail Mehr. We're going to take a quick break here on the Newsmaker Show. We'll be back in just a moment. When we get back, we're going to talk about the new St. James, which opens tomorrow. Stay with us.
The Ryan Agencies, your local, independent insurance agencies. At the Ryan Agency, they work hard to find the right coverage at the best rate. Their agents shop more than 24 insurance companies to discover your best price. Save smart. Contact the Ryan Agencies today for your best price.
Insurance protection you can rely on. The Ryan Agency.
Checking in now with meteorologist Rob Carolyn. Rob, how's it looking this morning?
Well, it's not looking too bad this morning, Brian, but that's going to have tendency to change as the week goes on. Looks like we've got a storm system headed our way from Missouri. That'll bring us some rain late tonight and into tomorrow morning. And then another system that's bringing rain to California this morning. That'll bring us some rain Thursday and Friday. Today, though, it's going to be a dry day. We'll see increasingly cloudy conditions, temperatures 45 to 50. Sunrise this morning, 7:20. The sun will set tonight at 7:18. Rain will arrive late tonight, probably after midnight. Lows falling back only to about 35 to 40. Tomorrow we'll look for rain in the morning, cloudy skies through the afternoon, temperatures 45 to 50 on St. Patrick's Day. It'll become partly cloudy tomorrow night, lows 25 to 30. High pressure's briefly with us during the day on Wednesday, lots of sun, 45 to 50. Then it looks like showers and milder weather for Thursday and Friday. In fact, we could be well up into the 60s Friday afternoon, Brian.
Back on Newsmaker, we're on today with Dr. Ismail Mehr, who's very involved with the new St. James Hospital, which opens tomorrow. I don't know how many times you must have been inside the new hospital. First, your thoughts on that.
Well, first and foremost, it's just to sort of finish off the coronavirus.
Sure.
I have to, kudos to our administration and our here at St. James. They've already been having meetings. They have a task force about COVID-19, about how to prepare for it for our community. Because it's not, I think people do need to understand, it's not if it comes to Hornell or if someone in Hornell is going to get it. it's going to happen. It's going to happen. So we have to start thinking that way. And the administration and the hospital is doing a great job in preparing for it. There's contingency plans and whatnot. Exciting thing is that we like I said, we're moving to the new hospital. A lot of memories in their old place for a lot of us, but I think we look towards the future. The new hospital is amazing. I understand last week, I missed the ribbon cutting because I was overseas, but over 1,000 people went through and toured it, and nothing but, just amazing remarks and hope and whatnot. A lot of people to thank for this. For first and foremost, the community for pushing and struggling and striving to save our hospital. If you remember, I think Sean and I were on the show about saving the hospital, and Mayor Buckley, myself, Tim Roselle, and Sean, we had that sort of save our hospital committee working behind the scenes back then, and kudos to all of them for their leadership. But I don't think it's said enough that Sean Hogan deserves a huge amount of praise and appreciation for what he did for this community and how he led us to fight for this hospital. Obviously, administration and the hospital and the board and all those as well. But there's always one leader that sort of leads, and Sean really did that. And the fruits are going to be seen of that on March 17th when we open up. We're actually moving the ORs this weekend, packing up, moving things over. State-of-the-art operating room and whatnot. But my big message is going to be to the community is let's look back 5-6 years ago. Save our hospital. It's got to be use our hospital now. At the end of the day, we're no different. Hospitals, yes, we're providing health care and taking care of lives, but for the doors to stay open, people have to come in. It's like healthcare is still a business. Okay, I mean. Look at our private stores and independent owners who struggle in town because people sometimes don't shop local. I'm a big advocate for shopping locally, right? If you don't shop local, those stores are gone. And then we hear people saying, well, there's nothing here anymore. We got to use the hospital. And kudos to Brian O'Donovan, our CEO. I mean, we've brought in state-of-the-art services now. We have amazing general surgeons, and they joined us when Dr. Collins was here to complement, Dr. Collins back then. And a lot of appreciation and credit goes to Doc Collins. He was also part of that Save Our Hospital committee, and he was a big push for me and a role model and like a father figure. And it's sort of sad that he's not here to see all this, but I'm sure he'd be thrilled because he fought tooth and nail to keep this hospital. But going back to using this hospital, we have a Duke-trained urologist from Duke University urologist that comes to Hornell. We have 2 great general surgeons. Have been meeting with multiple other surgeons who have shown interest in coming to Hornell. We have orthopedic specialists coming to Hornell. We have some great new hospitalists to work alongside Dr. Randawa. 2 new emergency room physicians who have trained in specifically just emergency medicine are going to be joining John Robshaw later this spring. I mean, the list is is endless in terms of what's coming here. Because I often hear in the community, well, we need better doctors, or we need this, or we need that, because so-and-so is no longer around anymore, or they've retired, and we didn't get the cream of the crop. Well, we're getting that now, right? If you build it, they will come, and it's happening with our physicians. But now the community has to have trust in coming back to us, and using this state-of-the-art facility, because we can do everything that we're doing right now at St. James and more, and a more futuristic environment, a state-of-the-art environment. So it's only uphill for us, but the community has to be willing and ready to come to the hospital. If your primary care doctors sometimes sort of lean towards referring you out of town, and I understand why they were doing that when the hospital was struggling 5-6 years ago, when we didn't have all the great, services and abilities to do things, and there was rumors of us possibly closing. Indeed, primary care docs were doing the right thing, sending you out of town. But unfortunately, sometimes that becomes a little bit habit or the path of ease, because it's just easier to do that because that's what I've been doing for the last 5 years. Ask your doctor, like, hey, I heard there's some great general surgeons at St. James, or I heard there's a urologist who was Duke trained who comes to Hornell now, or I heard they have a new ENT surgeon who was going to be joining us in June. Actually, do I need to go to Rochester to have the tonsils done on my kid now? There's going to be ENT in Hornell starting in June. So question your primary care and your referring physicians and ask them to say, I like to go to Hornell. And it's no fault of theirs. It's so much has changed and going on. They may, sometimes they don't remember that we now can do all this in Hornell. So yes, exciting times, and we're looking forward to working in the new hospital.
Dr. Ismail Mehr, it's always great having you on. Want to thank you so much for coming on today.
Thank you so much.